Badunu Parfait, fondly called Dr. Parfait, is treating this child for acute malaria. Parfait, the people's doctor, despite being a quack, continues to attract patients. Obviously, these pregnant women would rather squat, lie on anything and wait endlessly at this unusual reception. They could conveniently access the primary health center just a stone throw away, only if it had a residential doctor, according to Vivienne, the leader of SCOURGE community.
Because it's not doctor, like Causeway, they just go to Dr. Parfait from there. Yes, but it means I do told them say no. When make they go there, when our people go in there, yes. If you did not get any problem from there, then after that they will come to Dr. Parfait.
Badunu says he's a qualified nurse from an institution in Cotonou, Benin Republic, and has been attending to his kinsmen in the 6 Riverside communities for over 15 years.
I go to school, after school, from Cotonou. After school, I finished my second school in year 92. So I come now from the school now I enter this work. I entered doctor work from Cotonou there for Cotonou there. Okay. So I finished my certificate. I can't take my certificate and
which 90. School in Cotonou?
For Cotonou. In school, that's a nursery school for Cotonou.
If Dr. Parfait is really a trained nurse, what aspect of his practice allows him to keep a dog in the same consulting room that serves as a delivery room? Dr. Kunle Abiade, a veterinary surgeon, says the presence of animals in a facility like this puts the woman at delivery and the newborn at risk.
Whether it's an orthodox medical clinic, an alternative clinic, irrespective of the type of facility, nobody should keep a pet where human beings are also cohabitating, especially in a health facility. Nobody should do that because it could go a long way, especially the newborn. The immunity is still very, very low. A lot of infection, bacterial infection, salmonella, a lot of infection could be transmitted from such a dog.
While malaria remains a national issue, Dr. Chinyere Eziaka, a consultant pediatrician with the University of Lagos Teaching Hospital, says pregnant women and their unborn children are most vulnerable.
Malaria is a major problem in our country today. Actually, malaria contributes significantly to maternal and under 5 mortality. Starting with the mother, our NDHS studies show that very minimal proportion of our mothers are given those preventive drugs in pregnancy. Consequently, we're having children who psychologically, mentally, scholastically are not optimal. Some of them come down with cerebral palsy, mental retardation, and all sorts of neurological problems.
There was an attempt 2 years ago by Vestergaard Fransen, a non-governmental organization from Denmark, to eradicate malaria from the 6 connecting riverside communities. They are Gamvia Koji, Akokbonawa, Irede, Kloa Koji, Bishop Koji, and Sagbo Koji. Mosquito insecticide-treated nets were distributed and malaria drugs supplied to Sagbo Koji Primary Health Center. However, some of these local people have converted their mosquito nets to fishing nets. Their environment is still filthy, and the way their houses are constructed remains a challenge. A UK-based malaria control specialist recommends early diagnosis and appropriate treatment to deal with the challenges of the environment.
It's far better to concentrate on making sure that the people living around the salt marsh areas have, number one, bed nets with long-lasting insecticide and also well-screened houses. Also, of course, very important to make sure that they have access to early diagnosis and appropriate treatment.
With no malaria testing kits in the clinic, Joy Obasi says the frequent cases of malaria is due to lack of drugs for the different age groups.
Due to the malaria medicine we have here is very active for the children 0 to 15 years. It's very active. But due to they don't know how to read and write, maybe you say the woman you should give your baby 5 meals once in a day. They will end up giving 2.5 or 10 meals just once for the whole day. They will abandon the drugs. So for that reason, the malaria keep on persisted.
Bayo Adekoya, the head teacher of Sagbo Koje Primary School, says the high level of illiteracy in the communities contributes to their multiple problems.
Majority of these people are from the Republic of Benin, and without a government playing a vital role on them, they can consume nuisance to our environment. So the only thing that I would suggest now is for the government to use whatever means. Either I would rather suggest a force, so that they can be forced them to come to school.
The Lagos State Commissioner for Health, Dr. Jide Idris, however, promised to visit the area.
Told me is news to me, but as a responsive government, I will look into it. If I need to visit them myself, I will. First of all, what I would do is allow the local government chairman in charge of that area and I'm going to send some people there too to visit the place and give you more information. If I need to visit the place, I visit the place. I thank you for bringing this to our notice, and I will definitely do something about it.
At the 1997 Harare Declaration, African leaders promised to reduce by half malaria deaths by 2010. But with less than 2 months to the deadline, pregnant women, newborns, and children under the age of 5 who reside in communities like this around the continent remain at great risk. Vivienne, Irikefe, STV News.